Good afternoon, everyone. Thank you for joining us. It is just now 1:30 p.m. and I'm just going to give a moment for folks to enter the webinar and get settled. We do have over 450 registrations, so we'll just give a moment for folks to join us for this important information session for residents, families, and caregivers. Good afternoon, everyone. My name is Sam Peck. I use she, her pronouns, and I am the Executive Director of Family Councils of Ontario, also known as FCO. FCO is a registered charitable not-for-profit funded by the Ministry of Long-Term Care. As part of our mandate to enable effective family councils across Ontario, we host webinars to bring you updates from the long-term care sector and government partners, such as today's session, Long-Term Care Pandemic Response Guidance Changes. FCO's work and the work of long-term care homes, family councils, and family caregivers takes place on traditional Indigenous territories across the province we now call Ontario. And our team is thankful to be able to work and live on this land. Settlers, such as myself, have been called to advance the process of Canadian reconciliation with Indigenous people. In order to have reconciliation, we must first have truth. So I'd like to start this meeting with a land acknowledgement. Acknowledging the land is an Indigenous protocol used to express gratitude to those who reside here and to honor the Indigenous people who have lived and worked on this land historically and presently. It's a way to honor the truth of the original and ongoing inhabitants of these lands. First Nations peoples were the original inhabitants of the land that is now called Canada, and there are 46 treaties and other agreements that cover the territory of Ontario. We're appreciative of the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial, and who continue to contribute to the strength of long-term care homes and communities across the province. You can learn more about the people, territories, and languages of the land on which you live, work, and care at native-land.ca. I'm coming to you from Hamilton, which is home to the Anishinaabe, Haudenosaunee, Attawandaronk, Mississauga, and Mississaugas of the Credit First Nation. As part of our team's commitment to reconciliation, we're providing educational opportunities to help our staff learn more about our shared history, the Indigenous presence and land rights, impacts of colonialism, and the harms that have been inflicted on Indigenous peoples. While we're early in our journey towards true reconciliation with Indigenous peoples across Ontario, we have committed to establishing mutually respectful relationships with Indigenous peoples across the province. It's because we are grateful for the opportunity to live, work, and care across Ontario. It is now my pleasure to introduce the first speaker, Christine Loureiro, Director, Service System Planning and Operational Issues from the Ministry of Long-Term Care. Over to you, Christine.
Thank you so much, Sam, and good afternoon, everyone. And thank you for the opportunities to speak with you today about some of our recent guidance changes. So for today, just a quick housekeeping, we'll be using Slido to moderate the question and answer period. So throughout the presentation, you can feel free to add questions using Slido. So you can Google Slido or go to www.sli.do. And our meeting code today is MLTC 2022. Again, that's MLTC 2022. And there's a link to it in the chat feature of the Zoom app. What we're trying to do often we have a lot of similar questions. So we're going to try to group some liked questions together and try to answer as many questions as we can at the end of the presentation. Thank you. Okay, next slide, please. So why are we here today? So we wanted to share information with family members and caregivers of residents in long-term care homes to explain some of the recent changes that we've made so that you're aware of them, as well as to provide some updates on COVID-19 vaccines. So we have done that at a recent session as well, but we thought, one, it would be good to repeat some of the information, as there might be some people who weren't able to attend the previous session, as well as to provide some updates on the vaccine rollout. And then, as I mentioned, we'll have an opportunity to answer some of your questions at the end of the presentation. Next slide, please. So in terms of context for today's session, I start by saying we know that COVID-19 is going to continue to circulate and evolve along with other respiratory viruses such as the flu. But we're also at a point now where we're learning to live with COVID. We know how to protect ourselves and prevent severe illness, such as through vaccines and therapeutics, and health and safety practices such as masking and hand washing. As we've done throughout the pandemic, we've worked closely with our public health officials, and we're joined today by Dr. Sarah Erdman from the Office of the Chief Medical Officer of Health, who is also here to answer some questions during the Q&A. So we've worked closely with our colleagues in public health to monitor the trends of the pandemic and the evidence, the real life evidence, to help guide our guidance changes. And we'll continue to do that looking ahead as well. And these changes that we've made have really tried to strike that right balance between ensuring we have the right measures in place while also prioritizing residents' well-being. So you'll see through some of the changes that we're about to go over how we've tried to do that, because we know the toll that the pandemic and that the restrictions and measures have had on residents and on yourselves as family members and caregivers. So over the next few slides, we're going to go over those changes. And with that, I'm going to turn it over to Tanya Bass, who's a manager on my team, to go over those changes. Thank you.
Thanks, Christine. So we heard that residents miss seeing the faces of their loved ones. So while masks are still required, there's no longer a ministry requirement for visitors to wear masks when they're alone with the resident in their room. For residents living in shared rooms, homes should make best efforts to designate a space to enable residents who would like to interact with their visitors without a mask to be able to do so where it is feasible. Homes can now return to regular practice whereby the long-term care home operator is responsible for setting their own visitor policy. This means that there is no longer a provincial requirement limit of 4 visitors per resident at a time. And next slide, please. The requirements have shifted from active to passive screening for staff. Passive screening means that staff will self-monitor their symptoms as part of regular practice in long-term care home. However, we are continuing to recommend active screening for visitors and caregivers. Active screening means some form of attestation or confirmation of screening, such as a pre-arrival or an in-person questionnaire. While screening of residents to monitor for symptoms will continue, residents will no longer be required to be tested after an absence, unless the resident has symptoms. Next slide, please. Residents who have been in close contact with a person with COVID-19 are no longer required to isolate unless they have symptoms or are a roommate of a person with COVID-19. The definition of a confirmed outbreak has been updated to 2 or more residents with COVID-19 with a common link within a 10-day period. So it no longer includes staff or visitors in the definition. These changes to the outbreak definition and isolation requirements for close contacts will help manage staff absences this fall and winter, while reducing the negative impact of prolonged and repeated isolation on residents, and still optimizing the safety within the long-term care homes. Next slide. Staff close contacts are able to return to work without isolating, provided they have no symptoms and follow appropriate precautions. Staff who test positive for COVID-19 or have symptoms of COVID-19 but test negative may only return to work after following appropriate guidelines. So for example, staff who test positive may return to work 10 days after symptom onset, assuming they have no fever and the symptoms have been improving for 24 hours. Next slide. We also wanted to talk to you about the bivalent booster. We know that vaccines continue to provide good protection from serious illness and fatal outcomes, but we also know that that protection decreases over time. As we anticipate a challenging fall and winter respiratory season, it is most important to get a booster and ensure that residents and their families stay up to date with the vaccinations. Getting vaccinated is the most important thing we can do to protect ourselves and our loved ones. Last month, the government started rolling out the bivalent booster, which elicits an immune response and provides protection against both the original COVID-19 virus and the Omicron variant. It is strongly recommended that long-term care residents, staff, and caregivers receive their bivalent booster as soon as possible, which is at least 3 months after the last dose or COVID-19 infection. Next slide. Both Moderna and Pfizer bivalent boosters have been Health Canada approved and offer much better protection against Omicron variants than the original COVID-19 vaccine. There is no evidence that one brand is more effective than the other, but the timing of getting your booster and for residents to get their booster is of most importance. As of last week, almost 40% of eligible residents received their booster. Residents can get their bivalent booster in long-term care homes, while caregivers can get it in community settings such as pharmacies or vaccine clinics, as well as some long-term care homes. All COVID-19 vaccines authorized in Canada are safe, effective, and of high quality. Next slide. Homes have started to receive their influenza vaccines as well. The bivalent booster may be given at the same time, the same day, before or after any non-COVID vaccine, such as the flu vaccine. However, we don't want you to wait for the influenza vaccine before the resident gets the bivalent booster. Okay, next slide, please. The changes in this guidance came into effect last Friday. However, some homes may need more time to implement and update their policies. The ministry will continue to keep residents, families, and caregivers informed, updated, and listen to their questions. Next slide. Okay, we'll now open it up to questions. As a reminder, the Slido code is MLTC 2022. And we'll give folks a moment to add in their questions.
So I see one question on, will the slides be made available? So I'll answer that one first because that's the easier one. And then while the team's reviewing questions, give you a chance to do that. So yes, we will be providing the slide deck to Sam to share out with members. And we're also having the deck translated, so it'll also be provided in French when we do send out the slides.
This webinar is being recorded and will be posted to the FCO YouTube channel. The link will go out likely in next week's e-bulletin, so keep an eye out for that.
Thanks, Sam.
Okay, the next question, will isolation and testing requirements for non-vaccinated residents be maintained when there are high risk contact or have been exposed or out of home?
Okay, so I have a couple of thoughts to respond to this question. So first, I want to confirm that in general, there are testing requirements that remain in place for staff and for visitors and caregivers that are entering the home. In terms of residents, if they leave the home on an absence, maybe it's a social outing, regardless of duration, the ministry no longer has any testing or isolation requirements for residents unless they are showing symptoms. And that also applies if they are a contact of someone who has tested positive. So as they should be monitored for symptoms, and unless they're demonstrating symptoms, that's when they would be tested. What I will say is that some homes might have, they are able to implement policies that go above and beyond. However, they do need to do so with consideration of the requirements that the ministry has in place, as well as other laws that are in place, such as the Residents' Bill of Rights. And they should also be considering these in consultation with resident councils and family councils and their local public health unit in terms of what measures make the most sense at this point in the pandemic. So just to kind of wrap that one up, because I was a bit long-winded in the response, is that the ministry no longer has testing or isolation requirements for residents returning from an absence, and that's regardless of their vaccination status.
Okay, now the next question is on vaccines. Should I get my bivalent vaccine now, even though the last one was in June and health officials are saying to wait 6 months after the last vaccine?
Thank you, Tanya. So in general, health officials are recommending the 6 months for the general population. We are strongly encouraging those that work and live in higher risk settings, such as long-term care, to get it as soon as they are eligible, which is at the 3 months. So I think for the person who's asked this question, and I'm sure there's others on this webinar who have similar questions, I think it's for you to make a personal decision about what's best for you, whether it's the 3 or the 6 months. And you might want to consult, with the a care provider to make the best decision that's for you and your kind of like risk status. But there is a strong recommendation for those who are higher risk to get their bivalent booster as soon as they're eligible at the 3 months. I just wanted to see, Sarah, did you have anything you wanted to add to that?
Nope, that's correct. Yes, higher risk individuals are strongly recommended to get it at 3 months after their last vaccine or their last COVID infection.
Thanks, Sarah.
Okay, the next question is about swabbing requirements. We've got a few asking about whether family and visitors and caregivers, what the requirements are for getting tested upon entering the home.
Okay, I don't actually see the question up, but so just the question is just general about the testing requirements, Tanya?
Yes, of visitors.
Of visitors, okay, thank you. So yeah, so the rapid antigen testing requirements do still remain in place. And those are, so for staff and caregivers who are, routinely going into the home, if they're up to date with their vaccines, they are to be tested at least 2 times per week. And then for visitors, they should be tested before entry into the long-term care home, unless they were just tested the day before, at which point that test that they took the day before is considered still valid and relevant. So, but for many visitors, they'll be tested before at each entry, and we'll have to wait until a negative result before proceeding into the home. For caregivers, there is one kind of exception to that where they can proceed directly to a resident's room while waiting for the result of their test, but they need to keep their PPE, they need to wear appropriate PPE, and they cannot remove their mask until that negative test result has been received. And that's even if they're in the resident's room. So just a clarification there.
Okay. And similarly, a clarification on active versus passive screening for staff and visitors.
Sure. So the ministry has shifted requirements for homes to at minimum to enable passive screening for staff. And the difference really between passive screening and active screening is that passive screening involves more self-monitoring before arriving to the long-term care home. We do still have the screening tool that's available to ask about the kinds of symptoms that someone should be monitoring for before they present themselves at the home. The difference with active is that there's like an attestation, or someone has to confirm that, yes, I have kind of gone through that screening tool and I do not have any of the symptoms of COVID-19. So that's kind of the difference between active and passive screening. So we have shifted that requirement for homes, but do continue to encourage homes use active screening of visitors when they're coming into the home.
The next question is about masking policy in homes. So Christine's for you. Can a home make it mandatory for all visitors to wear masks, even if they are alone in the residence with in their rooms?
Thanks, Tanya. So kind of similar to what I was saying a little bit earlier, homes do have the ability to, implement policies that go above and beyond kind of the minimum requirements that the ministry has set out. However, they should really be doing so in consultation with their resident councils, their family councils, the local public health unit, and really be thinking about the residents' Bill of Rights and the residents' wishes in the home. I should have also added that this is also with the caveat that the home is not an outbreak. So in an outbreak situation, the home is very much following kind of direction and guidance from a local public health unit. And I see the next question's on outbreak, so I could have saved it for then. But just to reiterate, so while homes can kind of go above and beyond, as I mentioned, they should do so with consulting with their home community. In terms, and that applies to this masking policy. So there are certain places in our guidance where we do advise homes not to go above and beyond, but we have not done so with respect to the masking, because masks they're still encouraged as much as possible, even in the residence room.
Okay. And the next question, in an outbreak, are residents that are not infected allowed to go on social absences?
Okay, so for when homes are an outbreak, as I was mentioning in my last response, local public health units are providing direction and guidance to long-term care homes based on the circumstances of that specific outbreak. So maybe I might ask Sarah to comment on kind of some of the policies that might be in place in an outbreak.
Yeah, thanks, Christine. So yeah, in general, I was going to answer that. It depends on the nature of the outbreak and what the public health unit is advising. So residents who are in the outbreak area may not be allowed to leave, even if they're not testing positive on a social absence during the outbreak. However, if the outbreak is able to be confined to a certain area, residents that are not in that area, depending on the public health unit and what they're advising and what the situation is, may be allowed to leave. So definitely just check with your public health unit.
Thanks, Sarah.
Okay. And the other question, you might have answered this, Sarah, is also about outbreaks and accepting new admissions during outbreaks.
Yeah, in general, we would ask the homes to ask their public health units or their local IPAC hubs, ideally first their health units, to guide them on whether it's safe to accept new admissions during an outbreak. Again, it depends on the circumstances of the outbreak and whether or not it can be safely facilitated for that individual to be safely admitted and ideally not exposed to COVID-19 unnecessarily.
Okay, great. The next question is about communal dining or sharing food with family members. Can families share food together? For example, families bring Christmas dinner for loved ones and eat with them.
Yeah, thanks, Tanya. So in the kind of comfort of a resident's room where we are permitting visitors and caregivers to remove their mask, assuming there's no other staff person or other resident in the room, family members can share, a drink or food with the resident. So kind of the short answer is yes, but the kind of parameters around this are that it is within the resident's room where the mask is being permitted to be removed, and still not yet in the communal dining space. Or I should also just add, if homes do have kind of dedicated space, that also allows for a resident to visit with a family and friends without their mask on, it could also be held in that dedicated space.
Okay. And next one's about vaccine clinics. Will there be a clinic for residents to get the bivalent vaccine?
Yeah, so all long-term care homes should be working with their public health units on setting up clinics in the home for residents to get their bivalent vaccine, and they should be reaching out to substitute decision makers where that's applicable to get consent to receive the bivalent booster. So, the majority of homes have kind of clinics that are underway or are being planned. So you should connect with your long-term care home if you haven't yet heard about their clinic for residents in that home.
Okay, the next question is on outbreaks. Sarah, you might have an answer to this. We might need to take it back. What supports is the ministry putting in place to assist residents during an outbreak, especially for those who do not test positive?
I'm not sure if that's for me or for you guys. I don't have an answer. I can take that back. I'm not exactly sure.
I'm not entirely sure what the question is asking, if it's about supporting residents with going on walks while they're on isolation. I know there's some time to kind of get a little bit of outdoor air while they're in isolation. And then that for those that do not test positive, I think kind of similar to Sarah's earlier comments around depending on the nature of the outbreak, it might be that those residents don't even need to be in isolation.
Yeah. And to your point, Christine, I think we realize how challenging it is for residents to be in isolation, especially 2.5 years into this pandemic when it's been a huge burden on residents and their families. And so I think that we're trying to promote the fact that those who don't test positive, especially those who don't test positive, can continue to have some social activities amongst themselves, cohorted ideally to keep them away from residents who have not even been exposed during the outbreak. But so I think we're really trying to promote that, as well as, like Christine said, one-on-one walks, safely supported, when even if an individual does need to be isolated.
And I think that kind of answers the next two questions. I don't know if there's anything, Christine or Sarah, you'd want to add, but the next question is about long-term care homes being in lockdown for 6 weeks. And how are we addressing the mental health of loved ones? And now, while it's easier for people to visit, what is being done to help residents in ongoing lockdowns? In the past 6 months, our long-term care home, there have been 4 months of those have been in lockdown.
That's certainly very, very, very challenging. That's a really long time to be experiencing isolation and lockdown measures and outbreaks. I'd actually be interested, and not as part of this call, but kind of separately, just we can maybe look into this one specific home and follow up about this individual kind of circumstance. I think we're hopeful, and Sarah, you can feel free to add to this, is that with some of the changes to how we're defining outbreak, so for example, it no longer including staff, so that should reduce the number of outbreaks that are being declared to really focus in on when it's residents that are being impacted by COVID-19 infection. And then similarly, not isolating everyone who's been a close contact unless they have symptoms or it's their roommate that has COVID-19 to help really reduce the kind of impact of isolation. Again, this is also dependent on the public health unit direction for that specific outbreak. But in general, that's kind of some of the moving towards that kind of approach to help really reduce the amount of isolation time that residents are having to be placed in during outbreaks. I don't know, Sarah, if you wanted to add anything to that.
No, I agree, Christine. Nothing else to add.
Okay, great. Okay, so the next question is around eating with the resident. Is it only one family member at a time who can eat with the resident?
Yeah, thank you for that question and the opportunity to clarify that. So it's not limited to only one visitor or family member with the resident. What we just want to make sure is that it's just that one resident and there's no other staff person or resident in the room. The one exception to that, and we are working on communication to send out to clarify this, is if let's say the two residents in the room, for example, maybe it's a couple that share the space. If the visitors are going to visit both residents and there's, comfort and consent from both residents for those visitors to remove their masks, then even if there's more than one resident in that circumstance, then the visitors and the family members can remove their mask in that scenario and enjoy the meal or the cup of coffee.
Okay. So the next question, should caregivers and visitors stay away if they still have minor symptoms, even though they test negative?
Thank you for this question. And maybe Sarah can add to this as well, but definitely anyone with symptoms should not be coming into a long-term care home, even if their rapid tests are showing as negative. The rapid tests are not 100% reliable, and there are many false negatives. And so maybe even if you tested negative today, you might test positive in a day or two, and you might have exposed your family member or other residents in the long-term care home. So anyone with symptoms should not be coming into a long-term care home.
Yeah, and just to add to that, Christine, while obviously COVID is top of mind for everyone, we're also concerned about influenza, RSV this year, and both of those other respiratory viruses, both of those and all of those can have severe consequences for individuals who are older or have immunosuppression. So especially long-term care home residents. So we would really want to protect them from any respiratory virus, COVID or not. So I would advise that even if the rapid tests are negative, you should stay home and stay away until all minor symptoms are resolving, and for at least 24 hours after they've been resolved. So that would be the best advice to keep your loved ones safe.
Excellent point. Thanks, Sarah.
Okay. The next question is around isolation time. So that's for you, Sarah. Are there new changes to the number of days someone needs to be isolated?
Yeah, so long-term care home residents who test positive for COVID-19 are still, the isolation time has not changed. It's still 10 days. The biggest change is for individuals who are close contacts that are no longer required to isolate or quarantine unless they're the individual who tests positive, a direct roommate. And so that's the biggest change, as well as staff members and individuals in the community are advised to stay away from and have no non-essential visits for their loved ones or their residents in long-term care for at least 10 days from when they tested positive or their symptoms began.
Okay. The next question is for Christine. As a caregiver, I have to wait at the door for 15 minutes while I wait for results. Is this part of the normal recommendations or guidelines?
Yeah, thanks, Tanya. So yes, generally speaking, people should be waiting for their results before proceeding into the home. For caregivers, in terms of ministry requirements, we do enable, like we permit homes to allow caregivers to enter the home, but they have to be, while they're waiting for their test result, but they have to be wearing full PPE and can only go to the resident's room. They can't go to another communal space, but this is really left to homes to operationalize. So if it's not operationally feasible for homes to do this, they might be also having caregivers wait the 15 minutes until they can proceed into and have full entry into the home.
Okay. Okay, so next one is also Christine for you, around that balance of protection and guidelines easing. So at the time when transmission is increasing, why is MLTC increasing risks by relaxing measures such as mask wearing at all times and rat testing of staff? So maybe we can clarify some of the guidance there.
Sure. So first, just to clarify, the rapid antigen testing does continue to be required for staff and visitors. What has changed is just we call it the active and passive screening. So it's like that screening tool that goes through, like, do you have any symptoms? And, for staff, encouraging them to self-screen and monitor at home before coming into the long-term care. But staff still are required to test at least 2 times per week if they are up to date with their vaccines. If they're not up to date with their vaccines, then it's at least 3 times per week. And then in terms of why are we making these changes now? So I spoke a little bit about this at the beginning of the presentation in terms of we have great protection through vaccine, both at the kind of broader community level, but also at individual long-term care homes. And that has afforded us the ability to reduce some of the measures in place. And really some of these changes we've heard from residents and from family members, just the impact on residents in terms of the isolation and not being able to see their family and friends' faces because they're always wearing a mask. And not all residents have the ability to leave the long-term care home. So these were some things that we heard were really important for residents and for family members. So we're trying to strike that right balance between what measures make sense at this point in time of the pandemic, while also prioritizing well-being of residents and their quality of life in long-term care homes. Having said that, we are going to continue to monitor the trends in the pandemic, keeping an eye on any new variants that might surface. And, if we do need to enhance measures because that risk level increases significantly, then that's something, we'll continue to consult with the Office of the Chief Medical Officer of Health and other public health experts and see what makes sense at that time.
Okay, thank you, Christine. And the next one, I think you spoke to this, but it came up again. So maybe clarity around the status of consent when 2 residents share a room, but one does not have capacity to consent to removal of masks. So there's a nuance to that question about consent.
Okay, thank you. So in that specific circumstance, then I would say that the visitors and caregivers would not be able to remove their mask in the presence of, both residents being there if they don't have the ability to provide their express consent. What we hope is that there are opportunities, in the home, in another space where the home can, we're hoping homes can make best efforts to find other dedicated space where family and friends can visit with a resident without their masks on. But again, we can appreciate that might not be possible in every home, but in this kind of specific circumstance, if someone doesn't have the capacity to consent, then we should proceed as though they're not providing, they're providing their consent in that circumstance.
Okay, thank you. The next question is on masking. So perhaps another clarification on the policy there. Will some homes have the jurisdiction to keep masking a home-specific policy at all times, even in the residence room? So can homes go beyond the ministry guidelines?
Yeah, so thank you for the question, and similar to kind of previous responses that were similar to this, homes do have the ability to go kind of above the minimum requirements set out by the ministry. We do strongly encourage homes to be working with their residence council and their family council in terms of what those policies are. And so that would apply to the masking policy. So for specific kind of home questions, encourage you to work with your home and express your perspectives in terms of the masking policy in that home.
Okay, the next question is on vaccines. So which brand, Pfizer or Moderna, will the residents receive, or does it just depend on availability?
So there's no specific brand that's, designated or dedicated to the long-term care residents. Moderna was the first one that was approved, so that's definitely the vaccine that some of the homes would have had first. But now that they're both available, there's no evidence to suggest that one is better than the other, but they're both more effective than the earlier vaccines with the new Omicron variant. So less of like a brand preference, but more of a timing preference in terms of getting the booster as soon as possible. Many residents received their last dose back in January, and we are starting to see kind of that waning immunity since it has been several months since their last booster. So just more encouraged that residents get their booster as soon as they're eligible and with no brand preference.
Yeah, and just to add to that, they're both great vaccines. Moderna's dose is actually higher for their booster than Pfizer. So even though there's a lot going on in the media about Pfizer being the BA4 or 5, and so it's better targeted to what's circulating, the Moderna booster, especially in older adults, because it's a higher dose, gives a little bit more immune protection. So what we're seeing in the evidence in the data is that they're basically quite equivalent in terms of protection. And so both are excellent vaccines. And just to echo Christine, just get the first vaccine available as quickly as possible is what we're really striving for.
Thanks, Sarah.
Okay. So the next question is, how many doses is required to be up to date with vaccinations? Christine, I see you're off mute, so I'll let you start and see if Sarah.
I was going to let Sarah take this one.
Sure. So yeah, granted where we are in the pandemic, we're really going with if you've had your last dose within 6 months, you're considered up to date with your vaccines. That being said, for those who are higher risk, we are highly, highly encouraging individuals who are higher risk to get their latest dose if they've had more than 3 months since their last dose. So it doesn't matter the number of doses at this time, like we used to count the number of doses, but it more matters the time since your last dose. So that's what we're really focusing on. So technically the definition would be within 6 months from your last dose, but again, highly encouraging, especially residents, but also their families and loved ones and visitors and staff who are going into long-term care homes on a routine basis to go and get their vaccine if they are more than 3 months out from their last dose.
Thanks, Sarah. And one thing I'll add, and I'm not sure if this is one of the reasons why the question was posed, is for our testing requirements, the minimum to test at 2 times per week, you need to be up to date with your vaccines. And that definition aligns with what Sarah just described in terms of having received your last dose in the past 6 months. So for the purposes of that testing policy.
Thank you. The next question is again around boosters and policy in long-term care homes. So am I required to get a booster in order to visit my loved one in the long-term care home?
So in terms of ministry requirements, there's no current ministry requirement around vaccination status in order to enter a long-term care home. However, homes do have the ability to implement and maintain their vaccination policies. So this is when you should really connect with your long-term care home to see what the vaccination policy is for your home, especially as it relates to the new vaccine being available. Different homes have different policies in this respect for both their staff and for visitors.
Okay, the next question is for Christine. Who can we talk to if the long-term care home is not following ministry or family council guidelines besides the action line?
So thanks. So when we do encourage, obviously your first kind of your first, if you're having challenges, try to work through with the home and raise your concerns directly with the home to better understand kind of their policy. But you can also contact us, and I think we do have a slide in the slide deck that has our pandemic response email account. So you can contact us at the ministry and the pandemic response team to look into, we can help provide clarification on current guidelines. We can, depending on the circumstance, we might connect with the home just to better understand what's going there. It might be a situation of needing to also engage with the local public health unit. So if you are having some issues that you want to raise with the ministry, you can contact us at the pandemic response account. What I will say though is if you're wishing to make a formal complaint that requires an inspection to go through, that is what's done through the action line, and kind of that's that recourse option if it is a matter of needing to get an inspector to go in and make a determination.
Okay, the next question is, what about other people coming in, such as Rogers Repair? Do they require a rapid test?
Yeah, so any person coming in, including, we would classify this person as a support worker, so someone who's coming in to do work in the home that is not part of the long-term care home staff. Such as Rogers Repair. There's many examples of this. Sometimes it could be someone's the hairdresser, depending on the arrangements. So they are also required to follow the testing requirements, and they would be tested similar to a visitor. So they'd be tested at entry and have to wait for their test. So there are exceptions in like emergency situations. A paramedic coming in would be permitted to come in and deal with the emergency. And anyone who's only doing work outdoors would not need to be tested if they're just doing the work outside.
Okay, the next question for Christine, I think from the perspective of a visitor, a family member, if you live with someone who has COVID, but you test negative, when can you return to visit at the long-term care home? Or perhaps the question for Sarah in terms of guidelines around living with somebody with COVID.
Yeah, so we're still advising someone who's living with someone with COVID to avoid visiting anyone who's higher risk for 10 days out of an abundance of caution. And so that would include going in to visit a long-term care home unless you're an essential caregiver or a staff member, in which case we have very specific protocols in place to protect individuals in case they are asymptomatic. And so that would include being advised to test, being advised to mask at all times, for example, and avoid removing their mask if they cannot maintain physical distancing. I don't know if you guys have anything to add to that.
Oh, that's great. Thanks, Sarah. Okay, the next question is a bit of guidance around how do we know which policies fall under the purview of MLTC, the ministry, public health, or the long-term care home itself?
Yeah, thank you. So we've worked closely with Ministry of Health to make sure that our guidance is closely aligned with the guidance that they've put out for public health units. And our guidance, the MLTC guidance, is really the minimum legal requirements that homes must follow. So as I've mentioned previously, there are circumstances where homes may go kind of above and beyond. We have set parameters around that in some cases. So as an example, around vaccination policy, homes cannot have their vaccination policy applied to residents, or homes cannot have their vaccination policy applied to outdoor visitors. Another example is we've, in this most recent communication, advised homes to not go above and beyond related to isolation, unless directed to do so by the public health unit, and to follow guidance just because of the significant impact that isolation has on residents' well-being. So in general, kind of our guidance is setting like the minimum requirements, and then the home they have to meet at least those minimum requirements and have the ability to go above that in some circumstances. And then in an outbreak circumstance, then it's the public health unit who's providing guidance and direction to the home. So you'll see some additional measures that might be in place depending on the circumstances of that outbreak. I don't know, Sarah, if you wanted to add anything more to that.
No?
Okay. What about absences for hospital visits? Will returning residents be required to be tested with a RAT or a PCR? So Sarah, it's over to you.
Yeah, so no, returning residents, as long as they remain asymptomatic, would not be required to be tested with either. We would advise the home to closely monitor them for symptoms and be aware of any possible exposures that might have occurred. But other than that, no, they would not be required to be tested or isolated for absences for any reason, including hospital visits.
Thanks, Sarah. And the next question I think has come up and we've answered it around requirements or mandate to be boosted to visit loved ones. So there is no ministry requirement, but the home may go beyond the ministry requirements and require visitors to be vaccinated. Anything you'd like to add to that, Christine, that hasn't been said? Okay.
We can move on to the next question.
Okay, the next question. Why are staff not required to test at the home? Do they need to show proof of testing or is it an honor system? So perhaps a clarification around screen testing for staff.
Yes, so to clarify, staff are still required to test at the home and doing the rapid antigen test at least 2 times per week. If they are up to date with their vaccines. If they're not up to date, then it's at least 3 times per week. So in terms of the specific question, just a clarification that staff are still required to test. What has changed is the screening of symptoms. So they no longer have to go through kind of that screening tool asking like, do you have a fever? Do you have a headache at the door? They will self-screen at home in terms of having any symptoms, and staff are not to come to work if they have any symptoms.
Okay, great. So the next question, how will passive screening be monitored and checked that masks remain on until a negative test is received? Will PSWs be responsible for this? So this question is for you, Christine.
So in terms of passive screening, that piece, I guess the point behind passive screening is now we're really trying to move towards embedding that screening as a best practice in kind of the day-to-day operations and people self-monitoring before they even come to the home. I think what we found through our experience over the last several months is generally most people know not to go to the long-term care home if they have any kind of symptoms, and that includes staff and visitors. So that's kind of one of the reasons for shifting towards the screening. The testing still remains required in the home. And then the piece around masks. So for many people, they will have to wait for their results before they can proceed into the home. But for those where there is that exception to proceed through the home while they're waiting for their test results. So that's for staff and for essential caregivers. They can proceed. So for staff, they can proceed into the home with the PPE, and they should not be providing any direct care until that negative test is received. And then for caregivers, as I mentioned previously, they can proceed directly to the resident's room, but masks must remain on during that time. Having said that, I don't expect that PSWs will be kind of monitoring this directly, and it'll be up to each home to kind of operationalize what that looks like for that home and whether caregivers will be permitted, while waiting for a negative test, if they're if there's a risk that they're going to be removing their mask. So it'll be up to the home to kind of implement and operationalize what that looks like in the home.
Okay, the next question's for Sarah. Can the residents handle multiple vaccines at the same time, the bivalent and the flu shot?
Yes, so residents and anyone over the age of 5 is able to get the vaccines at the same time or anytime before or after each other. Yeah, it is only those 6 months to 5 years where we're asking them to spread them out a little bit, and that's only because it's relatively new in that population, and so we are just monitoring for an increase for any risks, and it's hard to do that if they're getting multiple shots at the same time. So yes, it's very safe to get multiple vaccines at the same time, and there's lots of evidence on that at this point. So
Great, thank you. The next one's also for you, Sarah. Why is the requirement to wait 3 months before getting a booster after having COVID?
yeah, great question. So it's not a requirement, and no one actually it's recommended, it's highly recommended because of how your immune system works. So after you get a COVID-19 infection, you get some immunity to that. It obviously wanes similarly to the vaccine, so it doesn't last forever, and there's new subvariants always coming, but the best evidence is that it lasts for at least 3 months, and so we're just trying to time the booster for when it makes the most sense for your immune system to protect you most going into the fall and winter season. So it's not quite a requirement, but it's recommended.
Okay, great. So the next question regarding the removing of caregiver masks within the resident room, is the caregiver allowed to eat and share a snack with a resident in the room?
So yes. That's my answer. So yeah, now that we've enabled masks to be removed by caregivers and visitors when in the resident's room, and assuming there's no other staff person or other resident in the room, the caregiver can kind of eat or share a drink with the resident in their room or in that dedicated space that the home may have set up for those types of visits.
Okay, great. So the next question is around roommates and testing positive. So in a 2-person room, one tested positive for COVID-19 with symptoms. What is the practice for the second negative tested resident to move to a single room if it's available?
I don't know, Sarah, if you want to speak to any outbreak management practices first, and then.
Yeah, so I think it depends. I mean, ideally, from an outbreak management perspective, we would want to separate the positive individual from their roommate, if at all possible, but recognizing that's not always possible. And this is individuals' homes. So it depends on basically the health unit would advise that, but it depends on whether or not the home is able to make that happen in a timely fashion or not.
Okay. The next questions are clarifications around definitions for vaccination. So perhaps this one's for you, Sarah, as well. What is considered up to date for staff vaccination? Does it include 2 boosters? And the question after that, what is the ministry's current definition as fully vaccinated?
Yeah, so up to date, again, with staff vaccines would be within having their last dose of vaccine within the last 6 months. So their primary series, so the first and second dose plus whatever they've had in the last 6 months would be considered up to date. So it doesn't really matter how many boosters you've had, it matters how long ago you've had your last booster or your last dose. So even if someone just got their second dose of the vaccine a month ago, they would technically be considered up to date with that definition, even if they haven't had a booster, for example. And the current definition of fully vaccinated, it hasn't changed. It's the primary series of two vaccines in general, or 3 for some who have severe immunosuppression. But so it's not changed. But that being said, really we're encouraging people to stay up to date, and that means getting your latest dose or your fall bivalent vaccine within the last 6 months. So, and if you haven't, then getting it as quickly as possible.
And I'll just add one piece to that around, so any of like the Ministry of Long-Term Care's policies that refer to someone's vaccination status, so like our testing policy is really reflecting the up-to-date status and having received a dose within the past 6 months. And then in terms of homes vaccination policies that they might have introduced for their staff or for visitors, encourage you to connect with your home to see if they've updated their vaccination policy now that the fall boosters are being rolled out.
Okay, so we're at time, so I think we can wrap this up. For any questions that haven't been addressed, you can always email us at mltcpandemicresponse@ontario.ca. And I will now turn it, maybe I'll turn it over to Christine and then turn it back over to Sam.
I just want to say a sincere thank you for spending the hour with us and for giving us the opportunity to go through the changes and answer some of your questions. And should additional changes be needed in the future, or if there's other opportunities to clarify things, we're happy to come back and do another session. So thanks. Over to you, Sam.
Thank you so much, Christine, Tanya, and Sarah, for being with us today to speak and present, and to their supports, Rena and Anastasia, for helping behind the scenes. Always very appreciated. I know that pandemic response is still top of mind for residents, families, and staff. We're not out of the woods yet, but the evidence and the thinking has evolved over time. So we appreciate you coming and sharing the most up-to-date guidance with us and allowing so much time for questions. I think you can see by just how many questions came in that this is still very relevant to caregivers and councils. To those of you who are watching live or the recording, should you require support with your family council, or you have questions regarding the pandemic guidance and need us to assist, providing a referral, an email address, or so on, please email us at info@fco.ngo. Sign up for our newsletter to get the recording of this session, as well as updates of pandemic guidance and any upcoming event notifications. In the meantime, stay safe, be well, and thank you for joining us.